name is Maria and I'm the founder of Celtic Angels Home Healthcare. We have an office in Weymouth and Needham, and we are on a mission to keep our patients at home where they want to be. Today we're going to talk about a very important topic, falls, and it's the number one reason why our patients can end up in the hospital. And as we all know, once you go to the hospital with a hip fracture, pelvic fracture, the recovery can be very, very long and arduous. So with that in mind, I'm very honoured to have Kate O'Sullivan from County Kerry, who's going to share with us the difference physical therapy has made in her life. Welcome, Kate.
Thank you. I'm glad to be here. Yeah, I do want to stress how important physical therapy is. Several years ago, I suffered a stroke and it just damaged my left leg. So I just, as I went down the road, it started getting worse. So recently, I started physical therapy again. And I have to say it was a good thing I did, because I had an experience on Thursday evening after an office event where I came out of a restaurant and I didn't pay attention to the curb. And I went off of it, and because I'm doing physical therapy, I was able to do all the balancing stuff, so I did not end up falling on my face.
Oh.
So I just want to stress that it became clear to me that I have to continue physical therapy, because I have had a few incidences of almost falling before I went into this program. So I strongly recommend it as part of the home care training.
So Kate, could you share with us what happened when you first went in for that initial visit? Like what did the physical therapist do? Did they do like an assessment?
Yeah, he did an assessment. He tested the strength of my legs.
Yes.
First, and then he noticed that my back needed a little attention. So he gave me a massage, and then he gave me some, I wish I could remember, he gave me some heating, electric zapping on my back, and I walked out of there just after the initial appointment. I felt a whole difference in my body.
Right.
I was able to walk a lot better.
Yeah.
And I had about 3 sessions, so every time I can feel the difference in the strength of my legs.
That's fantastic.
And I think the balance is a big part of it, because that's, as I said before, I went into this program of therapy. I really had many instances of almost falling.
Right. Kate, would you mind sharing with us how old you are, where you're working? I know she's a Celtic Angel. And why did you start physical therapy?
Okay, so I'm 82 years old and I am working at Celtic Angels. I have a lovely job and I live alone. And it came to my attention that I was having trouble with my walk. So I decided that it was a good idea for me to do some physical therapy. And I've had about 3 sessions, and I have already noticed a huge change in my body and in my balance, and how I managed to get off curbs and get in and out of the car, in and out of my house. So I strongly recommend it for people.
Now, did they set you up with an exercise program that you currently, do at home, or do you try to continue with the exercises, or?
Yeah, I have the therapy twice a week, and they have given me some tips on the different exercises I can do at home for strengthening my legs. And it's very simple exercise of just standing at a table or a counter and going on your tippy toes, up and down on your tippy toes. That's all the exercise they've given me so far. And I've noticed that makes a difference as well.
So you've noticed an improvement already?
I have. I was very excited last evening with the difference. Yeah.
Do you feel more confident when you're walking? You're not as afraid of falling because you're working with a physical therapist?
Yeah, I do, absolutely, I do.
Yeah.
I had an episode a couple of weeks ago, and I went off the curb and I had trouble with.
Right.
I did manage to stay erect. I did not fall.
Right.
And I think it's a result of the therapy.
That's wonderful, Kate.
Yeah.
That's great.
So anyway, I just wanted to emphasize that it's very important to keep active and do exercises and do physical therapy if you have the opportunity. You just have to get a prescription from your primary care in most cases. And they also recommend exercises that you can do at home. So it provides me with the ability to be able to work at my age. I'm getting younger all the time, and it's very nice to work and in such a lovely place as Celtic Angels. And I want to help the clients be inspired that if they need to get physical therapy, they should really do it. It's a very awesome happening. I've seen a very big change in my body since I started doing it. So I strongly recommend it. I realize that physical therapy can be hard sometimes, and it can be boring, but you should overcome that because it's very important, I do believe, to do it. And the other thing that I would like to say is taking care of yourself is not selfish. It should be called self-care, which is very important as you get older. And I believe that physical therapy is a huge part of self-care.
Kate, thank you so much for being part of this really, really important YouTube today. Our balance and keeping ourselves strong and healthy so that we can continue to work. Kate is our inspiration at 82 years of age, working, living alone, driving. I just want to be just like Kate. So we got to keep moving, as Kate said, a very important point. And, do those exercises, weights, training exercises, go to physical therapy, keep yourself strong. And I'm hoping that this has helped someone out there today. And God bless.